All right, come on in. You can take a seat here. I'm going to close the door for privacy, and I'm going to perform my hand hygiene. So my name is Chelsea. I'm going to be your nurse today, and I'm going to give you a head-to-toe assessment, if that's okay with you. Great. So it's just going to take about 15 minutes. Can I get your name and date of birth?
Brenda Gilligan, December 26, 1995.
Great. So I would double check with her wristband for another identifier. Can I get your height and weight?
5'4", 125.
Great. So her BMI is healthy and a normal range. And do you have any allergies that I need to be aware about? No. And if she did report any allergies, I would ask her what type of reaction she has. And any pain today on a scale of 0 to 10, 0 being no pain, 10 being the worst.
0.
0. So she didn't report any pain, and if she did, I would assess her with old carts. And do you know where you are? Where are you?
The doctor's office.
Do you know the year?
2020.
And do you know why you're here?
For my physical.
Great. So my patient is alert and oriented ×4. So to start off, I was able to see my patient walk in. I was able to see her gait. It was even and balanced. She was able to sit down on the table with no problems. Her posture is good. Her body structure looks great. Everything looks symmetric. I don't see any abnormalities. It looks like she has good hygiene. She is well nourished and she is well dressed for the season. So I am going to start up at the hair. So I'm looking through my patient's hair, and it's silky and smooth. The hair is evenly distributed. There's no signs of lacerations. The skin is all intact, and there's no signs of balding. Her head is normal cephalic, and it's in line with the rest of the body. Going down to the eyebrows, her eyebrows are symmetric. I'm looking at her eyelids and her eyelashes and her blinking, and that's all great. I'm looking at her nose. Her nose is midline. It's proportional with the rest of the body. I'm looking at her nose, and I don't see any drainage. If you just want to put finger on one nostril and breathe in the other nostril, great. So her airways are patent. And now I'm looking at her mouth. If you just want to say ah, the tongue. I am looking at her uvula, and that went up. Everything goes up, down nicely. Her mucosa is pink and moist. Her tongue is pink and moist. I don't smell any odor. That's alarming. There's no cracks in her teeth, no cracks in her lips. If you want to smile for me so I can see your teeth. Good, so there's good muscle use there. And now we will do your ears. So there's no drainage in your ears. I don't see any scaling, no flaking. It all looks intact. I see that she has piercings on the left and right ear. Do you wear any hearing aids?
No.
No. Do you work in an environment where it's possible for hearing loss?
No.
No. And do you properly clean your ears? Yes. With a Q-tip?
Yes.
Great. So now we're just going to do her eyes. If you just want to look at me. Okay. Okay. You just want to look at my pen. Good. So her eyes are perla. Her eyes accommodated. Do you wear glasses?
No.
No. And I can also see that her sclera are white and her conjunctiva are pink. We're going to go down to her neck. Her trachea is midline. There's no signs of accessory muscle use, no deviations, no jugular vein distension. We're just going to do a little range of motion. If you want to look right, left, up, down, great, and just roll your neck around. Good, so there's full range of motion in her neck. So now we're just going to go down to the upper extremities. I'm looking at her skin. Her skin is consistent with her ethnicity. I'm feeling the temperature. It's warm to the touch on both sides. I'm also just going to touch her face real quick. Good, her skin is warm. I see a couple of macules on both sides of her arms. I see that she has hair, which means there's good vascularization. Her skin is all intact. I'm just going to flip this over and take this off if that's okay. I'm just going to assess her radial pulse. Great. Great, so her radial pulse is a 2+ amplitude bilaterally. to the hands. I see that her nail beds are pink, her nails are soft. I'm just gonna pinch your fingers. Great, so her capillary refill is less than 2 seconds. I'm just gonna pinch your hands. Good. Her skin trigger is elastic, and we're gonna go like this. Great, so there's no clubbing in her fingernails. It's a normal angle of 160 degrees. If you wanna push out your hands, good, and go in, out, up, down. Great, can you wiggle your fingers? Awesome. And then if you wanna push up on me, go down. Great, like this. Good, push up on me. Great, so she has full range of motion in her upper extremities and she has good muscle strength. So now we're gonna do the respiratory assessment. Right now I can just tell from my eyes that her breathing is even and unlabored. It doesn't look like she's having any trouble breathing, but we're just gonna take a closer look at that. So if you just wanna take deep breaths for me. So we're gonna start with the bronchial sounds. Bronchovesicular. Vesicular. Great. Her lateral. Great. We're just going to come around to your backside. Just keep breathing for me. Great. We'll just do the lateral sides one more time. Great, so I didn't hear any adventitious breath sounds. There's no signs of wheezing or crackles. Have you had any trouble breathing recently?
No.
Great, so that's great. Now we're going to move on to the cardiovascular assessment. So again, just keep breathing. I'm going to start at the second intercostal space, the right sternal border, which is the aortic valve. And now moving on to the left sternal border, which is the pulmonic valve. Third is the Erb's point. The fourth is the tricuspid valve. And then the fifth is the mitral valve. And I would assess the apical pulse for 1 full minute. Then I would turn it over to the bell to listen for any murmurs. So I listened on the bell side for my S1 and S2 sounds and for any murmurs, and I didn't hear any whooshing, which is good. So now we're going to move down to our abdominal assessment. If you just want to lay down for me, I'm going to pull up her shirt and I'm going to listen into the 4 quadrants for her bell sounds. So we're going to start in the right lower quadrant. And then her right upper. And we're going to move over to the left. Great, so she has active bell sounds. And now we are going to palpate your stomach. If that's okay with you, just let me know if you feel any pain or tenderness. So I'm going in circular motions around her 4 quadrants with my fingertips. Great, you can sit up. So when I palpated, her abdomen was soft and non-distended, and it was non-tender, and I was also looking for any signs of bulging or bruising, which I didn't see. So now we're going on to our lower extremities. My patient would normally be in a gown for this assessment, but given this will work. So again, I'm looking at her skin temperature. It's warm on both sides. Her skin color is consistent with her ethnicity. I see hair. I don't see any signs of scars or lacerations, so her skin is all intact. I'm just gonna pinch you real quick. So her skin turgor is elastic. I'm going to assess her dorsalis pedis pulse. Great, so that's a 2+ amplitude bilaterally. I'm going to keep going down, just pinch your toes. So our capillary refill is less than 2 seconds. And we are going to do some range of motion if you want to go in, out, up, down. Good, keep moving your toes. Great, if you want to push out on me. Good, push in. Great, so she has full range of motion in her lower extremities and good muscle strength. And also, I just wanted to double check her carotid pulse. I'm not sure if I touched on that. Great, so that's a 2+ amplitude bilaterally. So that is it for our head to toe assessment. I would lower the patient's bed into the lowest position. I would make sure the bed is locked. I would raise the top 2 side rails. I would give you a call light. And do you need anything else right now?
Nope.
Great, so your doctor will be here shortly. So I'm going to perform my hand hygiene, and that's it for head to toe. I also forgot to add that during the GI assessment, I would ask my patient when their last void was, when their last bowel movement was, and any changes in their diet.